Well, good day. It's my pleasure in this series I'm calling Reflections from Pharmacy Leaders Advancing the Profession. It's my pleasure to have with us Dr. Jerry Bauman this morning. Dr. Bauman is Dean Emeritus and Distinguished Professor Emeritus at the University of Illinois at Chicago. He is the founding editor-in-chief of the Journal of the American College of Clinical Pharmacy, and he's well known for his research expertise in the area of antiarrhythmic drug safety and efficacy. He's also a past president of American College of Clinical Pharmacy, ACCP, and he's the recipient of ACCP's Russell Miller Award for sustained contribution to the clinical pharmacy literature. He's also the first PharmD who was elected as a fellow in the American College of Cardiology. So it's my pleasure to have and welcome Dr. Bauman with us.
Well, thank you. Thank you very much for inviting me. I don't often look like this. I need a haircut and I need a shave.
Yes, we're in a pandemic, so but very shortly people will be getting haircuts. So let me start off with, we would like to learn more about your journey to your distinguished career and as a leader in pharmacy. And when you share with us your journey, you may want to include key events or people who influenced you in your journey.
Well, I imagine this is for the students, right? This will go for the students. So actually, I'm a lifelong Illinoisan. I was born in a really small town farming community in central Illinois, but I actually grew up in Decatur. So you probably have students at your college that are from Decatur. So I grew up there. I met my wife there. And I had never worked in a pharmacy, but I realized because I would pass out at the sight of blood, I didn't want to be a physician. And I broke every piece of glassware in organic chemistry, so I settled on pharmacy. And at that time, there was only one college of pharmacy in the state, and that was in Chicago. So despite my parents believing that I would be killed, I went to Chicago and got my bachelor's in pharmacy there. And there I met a couple very important mentors in my life. One was Richard Hutchinson, who was the director of pharmacy and the head of pharmacy practice at the University of Illinois College of Pharmacy. And the other one was Henry Manasseh, who at that time was a young faculty member in pharmacy administration. Both of them, for some reason, sort of picked me out of the class and, helped me tremendously. They wanted me to continue my education. At that time, University of Illinois did not have a PharmD program. There wasn't one in the state. And so Dr. Hutchinson in particular basically pushed me to go to the University of Missouri at Kansas City. That at the time was a very unusual PharmD program that was situated in the middle of the College of Medicine, actually, at Truman Medical Center in Kansas City. And so I went there and got my PharmD, I did a couple residencies, and I ended up back on the faculty at the University of Illinois, where again, Dr. Hutchinson was still the head of pharmacy practice and the director of pharmacy, but I was extremely fortunate to begin working with a group of academic cardiologists that were specializing in arrhythmia treatment. And they took me under their wing and taught me a lot of how to do clinical science. And in particular, a cardiologist by the name of Rob Barnfine and I became great friends. And so that sort of started my career. But as you can see, it was really helped along by very strong, well-known mentors of mine. I had a number of them from Kansas City too that helped me: Joe Kubinski, Kim Kelly, Bob Ellenboss. They're all wonderful, wonderful teachers and great clinical pharmacists. So that's how I started.
Very good. Excellent. So my next question has to do with your legacy. In 20 years, what do you think will be your legacy? And I rephrase this question to really say, of all the contributions you've made to help advance the profession, what are you most proud of?
Oh, Well, I think, this is a very difficult question because you have to sort of talk about yourself, but I think I was extremely lucky in being at the early stages of clinical pharmacy, and so that helped me. I had a lot of people that didn't care if I was a pharmacist or what I was, and sort of helped me along. I think probably, I'll give you a couple of things that I'm very proud of, but then I'll go to what I think is probably my most important contribution. During the time that I was dean at the College of Pharmacy, we did extremely well. And I was the head of pharmacy practice before that. The college grew and its rankings went up. We hired great scientists. So I'm just overall very proud of, during my time as a leader at the University of Illinois College of Pharmacy, that it did so well. And it took a lot of work to make sure that it did. The College of Pharmacy is probably unique in the nation because it runs all the pharmacies in the medical center. And so we live in the real world and rely on those revenue streams. And that's a very difficult thing to do, is to make sure that a 350-bed academic medical center maintains hiring about 80 PharmDs. So I think it's the largest clinical faculty in the nation, and we're able to maintain that and actually grow it. So I'm very proud of that. The other thing I would say is that during that time, I am proud of the fact that I was the first PharmD that was elected fellow of the American College of Cardiology. It was, right now, there's all kinds of PharmDs that are both fellows, and they have their own section in ACC. And at the time, I was it. I can tell you the people in that organization didn't know what I was because I had lots of questions, and they always mixed up my degree. And so, I think that was an important first step for clinical pharmacists there. And I think the other thing is that during my tenure at the University of Illinois, I was asked to take on responsibilities that really I had no training for. I served as the interim provost for a while. I also served as the vice president for health affairs over the entire system for about 3 years. And that included running the hospital and also the physician practice. And at the time, I think I was the only PharmD, except for perhaps Bill Evans at St. Jude's, that was in such a position. So, I'm proud of the contributions I made during that. But I will end on the fact that I think probably my most lasting contributions, once you're an academic administrator, in 20 years, probably people, except for having your picture on the wall, people probably forget, what your actual contributions were. But I think probably my early research, when first 20 years of my career, when I basically dedicated myself to my clinical practice and my clinical research, which was collaborative with, as I mentioned before, with this group of cardiologists. We made some contributions that I think changed practice significantly. And those continue to last and continue to be referenced. So those are the things that I think are lasting in somebody's career.
Excellent. Thank you very much for that. So what advice would you have for students in their professional journey as they develop as leaders? And when I say leader, I'm often talking about the little L, how to advance the profession.
Yeah, I have several, I think. One is, I think, I'll tell you a story. When I was a student at the University of Illinois, and I was a pharmacy student, I took a class in hospital pharmacy that was taught by Richard Hutchinson, and he asked the class, as a pharmacist, who do you owe your most loyalty to? And, everybody, of course, said to their patients, which is the correct answer. But then he said, then who? Nobody got it right. And his answer was that you owe it to the profession. You owe it to the profession of pharmacy. And I've thought about that a lot, and I think that's true. So one piece of advice is that I really would ask students to get highly involved in the organization of pharmacy, whether it be the one that I got involved early in, which was the American College of Clinical Pharmacy, but it could be any organization, and to be politically active in bringing about change and hope and making sure that our profession has sustenance and visibility. So I think getting involved in the profession is crucial. I think the other thing is that as you go through your personal career, one thing I always told our students at Illinois was to take advantage of opportunities as they come about, and they will, even if you might not be completely secure in that. I mean, me as an example, when I was provost, I ran the University of Illinois at Chicago internally. I had no experience in that. And then I didn't mess it up too badly, I don't think. And I certainly didn't have any experience in running a hospital or a physician practice or the rest of the health science colleges when I was vice president, and I was very insecure about that. But it worked out. As long as you work hard and try your best and are honest and forthright, I think things work out. So to young students, those opportunities will arise. In my case, very surprisingly, I had no idea that I would be asked to do those things. But I would take advantage of that, and to take, when those opportunities arise, put your foot in the bucket and do it.
Excellent. Thank you very much for that. So my final question has to do, as we study history of the transformation of our profession, as we study the decade of the 2020s in a few years, one of the key events in that decade will be the COVID-19 pandemic. And like other things in our history, events that occur outside of pharmacy influence our profession. How do you see the COVID-19 pandemic influencing our profession and really creating an opportunity for the profession?
Yeah, I think that's a great question. Well, I think one of the major issues in pharmacy going forward is our reimbursement issues, which I think are broken, and also our scope of practice issues. And even though we don't want to appear as opportunists during this pandemic, I think it is a good opportunity for us to push on expanding our scope of practice. The pandemic has been, people have talked about the pandemic and other healthcare professionals, in which we've used the phrase all hands on deck. We need everybody helping out. Well, I mean, pharmacists are all about all hands on deck, and we should be helping out and expanding our scope of practice as best we can. And probably it's going on already without CMS mandates or changes in the Pharmacy Practice Acts of various states. But I think this is an opportunity for the profession of pharmacy to really get involved politically and try to expand our scope of practice, because we're trained to do so. I mean, I know full well how PharmD students are trained at Illinois and at Southern Illinois and around the country. We're trained to do much more than what we're limited in doing at the current time.
Excellent, excellent. Well, thank you very much. I appreciate your taking the time this morning and for your insights. It's been a pleasure. Thank you.
It's my pleasure, and good luck to the students.
Thank you.